full name and designation, please?
My name is Dr. Tamara Semei Spencer. I am the anesthetist at Tapio and also the acting medical director.
Okay, for the purpose of this interview, please hold mics there and answer in complete sentences as only your voice will be heard.
So, okay.
Yeah?
So, say that again, the first bit.
Hold mics there
Okay.
and answer in complete sentences as much as possible.
So I can say my name is. Got you.
The, Give us an idea of what happened yesterday and today from a Tapio medical director standpoint.
So, as a medical director, I'm very excited to be able to offer this service as a hospital to the St. Lucian public. Um, what it is that we are now able to do cardiac catheterization or further treatment for heart attacks. What it means for the St. Lucian public is that we now are providing this high quality of care. They no longer have to travel to Martinique or Miami to get these services. And we are just happy to be able to give this to the average person on the street within our St. Lucian population.
So tell me about, this has been a long time coming. So tell me about some of the trials to get to this point and what did it really means for the facility?
So I think Dr. Daniel would probably be the best person to expound on the trials of how he's gotten here. I think the first thing as the cardiologist he provided was the ability, first of all, we can treat heart attacks, but medically. So we give, depending on the type of heart attack you have, we give medication for that. If you have something called an NSTEMI, we're able to give you a drug to dissolve the clot that's in the heart that's causing the heart attack. The further treatment after dissolving the clot is something called an angiography, where you find a vessel, you place some dye, and it allows the cardiologist or the interventional cardiologist to see the vessels and to see where the narrowing is. And if it's needed, then you place a stent in that area to keep that vessel open so you get blood supply to that area of the heart.
As the anesthetist, what were some of your challenges during this?
So a lot of these patients, although they're medically managed, they still do pose some issues. They have slower heart rates. They may have some degree of heart failure still. So I, as the anesthetist, have to look out for, one, anxiety from the patients because they are sometimes afraid. Settling them mentally. It may be as simple as a conversation together with the cardiologist explaining what will happen when they're about to get stuck so they know what the next step is at each point. And you may have drops in blood pressure, drops in the heart rate, and I'm there to make sure that I treat each of these things as they happen so that the patient does not have a catastrophic outcome.
So most people would think with something like this, the patient is asleep, but the patient's awake.
No, they were awake because it's really just a simple area.
Tell me that in a complete sentence. So the patients are awake, why are they awake?
So the patients are awake throughout the procedure. The interventional cardiologists place a little bit of local anesthetic either in the wrist or what we call the femoral area, which is the groin. And you pop the needle in, and that is really all the discomfort the patient feels. The local anesthetic numbs the area, so once you pop the second needle in, you really shouldn't feel much butt pressure. So there's no real need for the patient to be asleep during this procedure.
What are some of the advantages?
Of the patient being awake? So I have seen the procedure where the patient is asleep, but it's usually from an out of hospital cardiac arrest. In other countries where the patient would be given CPR outside by the ambulance services, brought back if they had what we had loss of circulation, which is what we call it, brought back, they're intubated, and then at that point they come into the cath lab and they get the stents put in. In those cases, you tend to cool the patient on ICU for 24 to 48 hours, and then you wake the patient back up to see what their neurological outcome is. Because in that time, if in doing CPR, you may not have had proper blood supply to the brain, and they may suffer catastrophic brain injury just from not getting enough blood in that time during CPR or return of spontaneous circulation. So if you're asleep during this procedure, you're probably in a bad way.
From your experience, let's just discuss prevalence of heart conditions in St. Lucia.
That's a,
Anesthetist, tapio. Okay, what does this is medical director hat? What does this capability mean for St. Lucia and the rest of the OACS?
So as we develop these procedures further, we now again can offer cardiac catheterization or remedying heart conditions or heart attacks for the St. Lucian public. And that is a big step. You will speak to Dr. Daniel and he will tell you how long it has taken us to get here. Our aim, after we have warmed up our St. Lucian public, is to be able to offer this to the rest of the OACS. The other countries that now provide it are Barbados, Trinidad, and Martinique. There's no need to go anywhere. If we can do it, we can provide the service and help treat our St. Lucian public.
Is there anything I forgot to ask that you
No, I don't think so. I think that's pretty much it. The rest will expound on the cardiac stuff and all that. And I'm sure Dr. Daniel, as chairman of the board, will take you through the process because I'm jumping in somewhere. He's taken it all the way from pacemakers to where we are right now.
Thank you so much for your time. Tell me your full name and designation one more time.
My name is Dr. Tamara Semei Spencer. I am the anesthetist and ICU consultant and also serve as the acting medical director of Tapia Hospital.
Spell your Semei, please.
Semei.
Thank you very much.
Thank you.